It's wonderful to be here today, wonderful to be joined by all of you, but also my colleague and friend, Dr. David Batman. David and I have known each other for 11 years now. David's a member of our esteemed Science Advisory Board, prior to which he started his career in general practice before becoming a specialist in occupational health medicine. So today we've known each other that long, it'll probably feel like you're eavesdropping on a conversation between two friends. It can go in any direction with David and I, so we'll just roll with that. And then we'll open it up to the floor for any questions that you may have as well. Before we kick off, David, can you just set a little bit of the scene as to the work that you're currently doing in the space of employee mental health?
Yeah, well, let me say, first of all, it is great to see some faces which aren't behind a screen, and it's probably the first time somebody's not actually asked me to unmute myself, so that makes a big difference. I came into the world of general medicine, that's all I wanted to do, but rapidly realised that there wasn't a difference between mental and physical health. But working in general practice, it just wasn't going to work. I retrained as a specialist in industrial medicine. I'm trained to the same level as any hospital specialist. I'm a consultant in industrial medicine. I spent 20 years as Chief Medical Officer, Head of Wellness and Employee Safety for Nestlé. My biggest stressor and cause of pressure there was my professional boss, believe it or not, was called Dr. Robin. So we had Batman and Robin. So nobody laughed like you, though. It was really strange. But I've spent the last probably since 2008, working for a range of businesses, including Virgin Pulse. My expertise has developed into mental health at work, resilience. Sleep is a big one that people most underestimate, and I talk a lot about that. But since we've come into the pandemic, and mental health was always on the agenda, some of the things I've been up to is, particularly with Virgin Pulse, and a lot of people with the complexity of mental health, they don't know who to trust. So we've become the voice of reason. So we've run a lot of webinars where people can come to us and my colleagues, knowing that we could trust, give them science-based information on what was the best things to do. I'm doing a lot of work on training line managers to recognise and manage people with mental health problems. How to have those difficult questions, how to feel comfortable, how to support people as well at the same time. I've also done some work in terms of resilience and sleep and supporting people. I've done a lot of work with the track and trace team, for instance, in the NHS, helping them. I'm doing a webinar for the Cabinet Office in a couple of weeks' time, looking at mental health. So it's become, rather than the hands-on, face-to-face, it's becoming that trusted voice of reason, giving them, taking the complexity out of mental health, because it is a difficult subject, and getting it down away from the medical language, scientific language, into language that you can understand as professionals at the coalface.
Thank you, David. And knowing that we've all experienced a plethora of different emotions over the last 18 months and gone through an enormous amount of change and turmoil, what are you seeing as the key influences now that are impacting individuals' mental health?
I think the common ones are uncertainty, lack of trust. Where do you go for trusted information, etc.? There's so much disinformation, misinformation out there. Isolation. I mean, it's great to be in a room with everybody. You're even isolated, though you're with people on Zoom or Teams or whatever it is, stuck in those same four walls at the same time. And I think the other big one is been the impact of the media and social media. That has had profound impact on everybody. I'm telling people, and I practice it, I don't watch the news, and only once a day, and that's in the midday. I switch off from social media, etc. I think there's been a lot of different ones, and we're all different human beings. But those are sort of the common ones that have impacted people. And when you think of people, we are used to socialising. And socialising in the past might just have been the commute to work with colleagues. It might just, that conversation at the water cooler, a lunchtime walk, etc. We've missed those. And I think work has become, it's morphed into every aspect of our life. And I can remember seeing a cartoon which says, do I work at home or do I now live at work? And I think that difficulty in separating the two areas of our lives, and then you've had to cope with homeschooling. And a lot of parents have realised teaching is not the profession for them, and suddenly teaching has become a very recognised job, etc. And I think we've learned to do that. But there's a lot of people, and I look at the hybrid model of working we've just listened to, but we've actually got to factor into that the hybrid model at home. You know, how do you, it's too easy, isn't it, when your laptop's open, whatever time of day it is, just to nip in, I'll do 5 minutes work, and 2 hours later, you're still there. But I think it's really been the uncertainty and the complexity which has really harmed people. And I think if I bring lack of trust, as a physician, as a doctor, and I talk to lots of doctors, Part of the lack of trust is, do you trust your doctor? You never trusted politicians and estate agents anyway, but that's different. But we've been accused of changing our minds. And one of the things that I've learned over the last 20 months with COVID is to be humble with this virus and actually be able to say to people, no, I don't know all the answers, because I'm learning things all the time. It's been honesty. It's about communication. But it's about actually people coming to you, coming to me as that voice. And yes, I'm not changing my mind. I'm learning something new literally every week. But then I've got to convey that change to other people and to realise that we are here to help. And I would say you're all from organisations. Organisations now need to step up to the plate in managing employee support, because the other really big stressor is getting hold of your GP. It's almost impossible. And that 10-minute consultation in mental health is ending up in a prescription. And that does not work. And we're looking at the massive increase, 5-fold increase in prescriptions for sleep medication, antidepressants. People actually want to talk. They want to be listened to. They want to be heard. They need support. And that's what you can do in the world of work. But you need support.
And that's a nice segue, I guess, to ask, what are you and your medical colleagues finding the most effective way of actually supporting and treating people with mental health challenges or issues?
I personally, as Jill knows, I'm not always politically correct, and I don't always go to the required standards. A 10-minute consultation was never in my book. I certainly, for the last 20 years, it's been a minimum of an hour per person. Because what you have to do, and I think the skills for you and line managers, is to listen and to hear. And it's the hearing bit that we're often not very good at. We listen because we think we know the answer we're going to give them before they start the conversation. But you need to give them time to talk. Don't intervene. So you need to see and observe body language. Even over Zoom, I've got used to picking up the body language as well at the same time. But what we found is getting access to that knowledge that people need. And I think, so I've done a lot of work with the Virgin Plus platform there, etc. And men have always been very difficult at coming forward with mental health problems, but they will talk to bots. They will come into a system if you can give them good, sound, simple advice on resilience, on sleep, but just to actually recognise that. So I think it's giving them good, sound advice and keeping it simple. So it is around resilience. It's about sleep. It's about mindfulness is another great thing that really makes a difference. I know it's difficult. I've had my 15 minutes of mindfulness today, and I do it all the time, and I recognise it. It's about the simple things, and people don't actually recognise that actually just walking, exercise, getting outside is like talking to somebody else and actually opening up and asking that question. I train our managers to say, what can we do? How do we start a conversation? 3 words, how are you? But then if I asked you the 3 words, I know what you'd say, I'm okay. That's traditional British approach. You follow it up, no, how are you really? And then people will open up. And it's about finding that quiet place to do it. So I think it's doing that. I will say over the last 25 years that I've worked outside mainstream medicine and worked with businesses like Virgin Pulse and other ones I work for. I've helped a lot of people. I can't, through various mediums, I don't know how many million I've helped. I last wrote a prescription for an antidepressant 25 years ago, and I haven't written one since. And I think that's the way to go. It is about listening to people and understanding what their needs are.
Lovely, thank you. As we're moving into a lot of organisations encouraging their employees to come back into the workplace, we're hearing a kind of a mixed emotion, some people really celebrating it and looking forward to it, others that have a wave of anxiety when they think about it. What are your thoughts about that?
Yeah, I mean, today was the first time that since, I know it was February the 23rd last year, I've stepped on a train. I got up to the platform. I was anxious. I was looking around. I was wearing a mask. It felt quite fearful. Just coming here today and interfacing with people. You don't know who's out there, who's got this virus, etc. And I think one of the most important things is if I look at you all, I had a mental picture of you before I came into this room, of every patient I see before I see it. And you to me are a flock of swans. Because on the surface, and you know a swan, you are gliding on the surface and you are showing me that you're in control, it's serene, you know what you're doing. Underneath the water, that swan is paddling like mad. And that's what people are doing. And I think I would say to anybody, whether it's a doctor or in business, don't have preconceived ideas about how people are feeling and how they're behaving, because there's a spectrum. Probably 17 to 20% of people pre-COVID had mental health problems that we saw at work. The other 80% we didn't see it. A lot of those have got worse because they couldn't get the help either through counsellors, AAPs, doctors. So they've got worse. The other 80% that had those problems haven't been supported. So they've got worse in that. You then got other people who've lost loved ones. They couldn't go to funerals. They couldn't grieve properly. My source of pressure was not being able to. I didn't see my grandchildren for 15 months. That was terrible. We've got a daughter with multiple sclerosis. I couldn't help her. I was frightened of her catching it as well at the same time. You don't know the inner workings of people. And then if we look at these people who are, like I said, reticent about coming into work, and because we've all changed now, we're comfortable at home. As the previous speaker says, as long as you could dress above the waist perfectly to everybody else, you were perfectly okay. But apart from that, it was difficult. But I'll tell the story, because I think people remember stories more than facts. I can remember many years ago watching a hang glider. It was on the island of Fuerteventura, and it was clearly his first jump. He'd got his wings on, and he walked to the edge. And he walked to that edge probably for 20 minutes, backwards and forwards. He wasn't going to jump. And then he eventually jumped. He came back about an hour later and just walked straight to the edge and jumped off. I managed to talk to him later on, and his story he said was, I said, well, what happened to you? He said, I went to the edge, but I didn't know what was out there. I didn't know what the journey was going to be like. I didn't know where I was going to land. I didn't know whether I was going to like it. But once I'd actually made that first jump, it was fine. And I think the key message of this, not get a pair of wings, the key message of this is, it is not the event that is the problem, it's the way that you think about it. And I think that is the problem, and we've got to actually get mental health, mental well-being onto the agenda to understand these issues about how we think. The number one top tip when I talk about resilience, it is about, if you can't change your circumstances, change your attitude. And I think that makes a big difference. So we recognise these people who are worried about coming back to work. They haven't seen your place of work. They don't know how safe it is, how secure it is, who are they going to meet, when are they going to meet, how are they going to get there. So the issues is about communication. You will have secure workplaces, but they don't know that. So communicate in simple language, communicate. And I found one of the best things to do when you've had people who've made it safely back to work, a sound bite from them through a video. It only needs to be 2 or 3 minutes, and maybe showing the workplace, but a colleague saying how safe it is, how simple it is, makes a huge difference. So communication is a big one. But don't assume that they know what you know. That isn't there. And make all this information available to them. Once they've done it once they've done that jump off the cliff once with the wings, they'll come back in again. I'd be happy to make a train journey again today. I'd be happy to come into a conference, but I had to experience it. And I think this is one of the keys to it.
Lovely, thank you, David. And you mentioned a minute or so ago about the importance of having mental health on the business agenda. I think the fact that everyone's turned up to this session today, they probably, I'd hazard a guess, agree with you on that. For individuals who are still struggling to get leadership buy-in, what advice would you give them?
I think we've all, when you've worked in the wellbeing sector for a long time, one of the things that businesses struggled for, they wanted an ROI. What's the return on investment? What do I get out of it? COVID has shown us what the impact of a simple health problem, and it is really a simple health problem, can have on personal and business wellbeing and performance. So I think the answer is now wellbeing, and I say to businesses, don't talk about mental health and physical health, talk about health. Because the causes are the same, the successes are the same. Talk about health. But above all, you've got to have an element of trust in this. And I think the best businesses I've worked with, where we've actually been able to sit down with the leader and explore mental health with them so that they understood it. And I remember going to a chairman and after a conversation, seeing him a second time, and said, do you need any more conversations? And what he said was, he put his hand on his heart and said, I get it. And I think, by focusing on an individual, and if you can have these champions at board level, at C-suite level, so that's where the work needs to come in. But then line managers need to hold. And I think, again, what line managers, they're busy people, but they've not been trained to manage people largely. It's about product, it's about budget, it's about success. And I would like to see a new raft, not of managers, but of empathetic leaders at all levels, because empathy is the key to this. And I think that would be my message. But you're going to have to keep working at it. It's not a one-off. This is a journey, but it's a never-ending journey.
Lovely, thank you, David. And I think we're out of time. Do we have any time for any audience questions?
I don't. Ooh. Are we working now? There we go. I think we've probably got time for just one quick one. So looking on the app, there was a question about when do you think things might return to normal once we're through the pandemic in terms of mental health, although mental health was obviously already quite a big issue before the pandemic.
I challenge you saying that's a quick question.
Yeah.
I can give you a quick answer. Did we like normal in the past anyway, is the first thing. Was normal the right thing to do? Was normal helping people? Was normal helping your business? But I think in terms of COVID, I don't believe we're ever going to get back there. We're never going to defeat this virus. It's going to become endemic. It's become the common cold of where it was. Become a childhood illness, almost effect, that we learn to live with. And I think the most important thing is, I'm not here to preach, the vaccine will make a huge difference, but we need to just alter our ways and get back to it. It's trust, it's conversations, etc. But above all, we've got to be less fearful. I say, stay off the media. Don't listen to the numbers. We hear the numbers, 150 deaths a day. There are 3,500 people who die a day in this country from all causes of illness. You don't see that, you don't hear that. It's not the biggest proportion of deaths that we've got. So I think watch the media, watch the social media, be less fearful, but get vaccinated.
Well, thank you very much, both of you. Excellent talk this morning.
Thank you. Okay.
So if you could all please remember to rate the session in your app, that's really helpful. We all value your feedback very much. I'm sure that both Jill and David will be available on their stand later if you want to pop over and ask them any other questions that you may have. We've now got a short coffee break, which I'm sure all of you will be grateful for. And you've got time to visit the exhibition, and then the sessions will start back again at midday. So thank you very much.